Okay, so these are your patient experts on the front line. And they are going to share about their journeys with you today. We don't have a lot of time. We only have a half an hour for this. I'm only going to ask a few questions of them, and then I'm going to open this up to you. So if you have any questions, start thinking about them. You can pose them when I'm finished. So I'm going to ask each of these ladies if they will share a little bit about their journey, just a couple of minutes, and we'll get started with Tracy.
Thank you. I don't talk very loud, sorry. I'll try to keep this quick, but I typed it so I didn't go over, sorry. I want to thank everybody for being here, DT, excuse me, or for having us and allowing us to speak. Quick synopsis. My journey is not like many of the others. Unexplained pain. I went misdiagnosed for 2.5 years. My diagnosis took 11 doctors, 29 plus scans, 2 shoulder surgeries, invasive testing that caused a CSF leak that took 5 months and 3 blood patches to repair. And after that, I had an ACDF spine surgery. I was at my breaking point. I knew something was wrong with me, and I cannot tell you how many times I was told to just be patient. I was out of patience, and I had long had enough. I told the doctor I was not leaving his office. I'm only 5 foot, and I can assure you, I think I scared him that day. I would not leave his office until he had a plan for me. Within the next 24 hours, I saw an oncologist and an ENT. They both realized there was something going on and sent me to a specialist. No one should be expected to live like I was living. Before all this, I was an avid hiker. If you're an outdoor person, you know that's just kind of your solace. I have not been able to hike in over a year. I'm 5 to 15 miles on every weekend. I did 52 hikes before I was diagnosed, and it has sat me down. Just trying to get through a work day. I'm in bed by 6:30. You're in pain all the time. From there, I was sent to the specialist. It was a whirlwind after that. Quickly, they had diagnosed me. I started a targeted treatment. Within 3 days, I was out of pain for the first time in 3 years. Unfortunately, my liver decided that we weren't going to play this game, and I had to come off the treatment, and the pain came back as quickly as it was gone. I am now 9 weeks with no treatment, just trying to get my liver enzymes back to somewhat normal so I can start a new treatment plan. What you're doing is so important. I thank you all for allowing us to be here.
Thank you so much, Tracy. Tiffany, do you want to go next? Sure. And with the microphone, you can be like 2 or 3 inches away from it.
I first noticed something was wrong with my left leg in mid-2017. I began to seek medical attention at that time. My leg would often give out and felt very weak. I was ordered an X-ray and findings showed patellofemoral disorder. I was advised to do physical therapy, which I did for a year and had to stop due to financial reasons and no progress on my leg. Without answers, life went on. Then the pandemic hit and life got away from me. Meanwhile, my leg continued to increase in size and my range of motion became severely impacted. I was in pain every minute of every day. I began to feel like a prisoner in my own body. By May of 2024, I decided to take back my life. I visited with an orthopedic specialist who ordered yet another X-ray. The findings from that X-ray showed nothing of concern. At that point, I pled for an MRI, which was finally granted. The MRI revealed 2 masses in both my lower left leg and calf. The orthopedic specialist referred me to an oncologist who ordered a biopsy of my leg in June of 2024. Following 2 biopsies, both masses were determined to be desmoid tumors. In August of 2024, I began a targeted chemo drug, which improved my quality of life significantly. I have been struggling with cognitive decline, which has taken a toll on me mentally and overall.
When did you start having pain with your leg, and when were you actually diagnosed with a desmoid tumor?
I started having pain in 2016. I was diagnosed in May of 2024.
Thank you.
So Jessica, can you share with us as well?
Sure. So most of 2019, I had a lot of pain in my shoulder and my arm. At one point, it was completely numb in my left arm. And one day in March of 2020, I had a lump in my shoulder, so I went to the ER. I live in the middle of Wisconsin. There's not very many places that know anything about desmoid tumors up there, so they had no clue what it was. They sent me up to Wausau, did a CT biopsy. They had to send it out to a different clinic because they didn't have the resources to figure out what it was. So then it came back that I had a desmoid tumor, and saw an oncologist, and then that oncologist was not very familiar, so I was referred other places. So I ended up down in Milwaukee at a hospital there at Frederick. So anyway, so it's in my left shoulder. It's wrapped around my brachial plexus. It goes into all of my muscles in my arm and then down into the axilla and the chest wall. I've done radiation, chemotherapy, 2 oral therapies, 1 chemoembolization, and 4 cryoablations since March of 2020. Basically, my biggest concern, I'm a nurse, so mobility of my left arm is the biggest concern I have right now, so, and pain control. So.
Thank you. Thanks so much. So this question is actually for Jessica. All patients, all desmoid tumor patients want their tumors to disappear, but every patient's journey is different. Should a desmoid tumor specialist assume your priorities are the same as other patients?
Absolutely not. Some patients might have the pain control as their number one or whatever, minus mobility. Like I said, trying to get my arm to move, doing physical therapy, stuff like that. So no, it depends entirely on the person and what they need for their quality of life.
Great, thank you. And then I have, and this is the last question that I'm going to ask before we open it up. Tracy, can you share a message with the people in this room, knowing that, I mean, this is a captive audience of physicians, of scientists, of people that work for drug companies. Can you share with them?
I can try. This is relatively new for me. I've just recently been diagnosed. Sorry. Thank you for choosing the work that you're doing and devoting your time and your talent to something so rare. It's so life-changing for those of us that have these desmoid tumors. Day-to-day life starts with pain meds for me. Just to go to work, I can't afford to lose my job. I've got to have this insurance right now. That's another story. I get home from work, I'm exhausted. I go to bed by 6. And that doesn't sounds great to some people, but that's not who I am. That's not my life anymore. It's so important what you're doing. Living with the DT is not just about managing the pain and monitoring the scans. It's uncertainty for us. We never know what the next step is. I'm sorry. Carrying this weight every day is exhausting. I've been through the treatments. Like I said, and then I get a setback. I know when you're researching, you get setbacks, but please keep working and keep thinking of those of us that are sitting up here. We're counting on you to help us. And just give us something to hold on to. We need hope so that we can find something that gets us through. Thank you. Can't come fast enough.
Okay, so let's thank you so much, ladies. So we just want to open it up. Who has questions for these ladies? And you can just speak from there, from your mics. We have Tracy, Jessica, Tiffany.
I can ask a question. First of all, thank you for being so brave to be up there. It's not easy to get in front of an audience of strangers. It can be a bit intimidating, but obviously I can assure you it is a very great group, and you don't have to worry about any of that, but we appreciate you coming and telling your story. You know, there's a common theme that each of you mentioned, which is a delay of diagnosis, which is something that is a very common thing that as an oncologist, we get, you typically hear about these patients after they've been through a lot that you've been through. So I was curious from your perspective, what things maybe can be done to help so that that time course is shortened so that you make your way to the right people for others, that are in similar situations.
For me, the radiologist played a key role. Over 29 scans, not one of them was the same. One said it was a fatty mass, one said there was nothing there. You can physically feel it. I'm sorry, I forgot to mention that. I have 2 tumors, one in brachial plexus, one in the SCM, and it's kind of sandwiched in the scalene muscles. They just could not diagnose me. And the radiologist, the doctors are looking at the radiologist saying, well, there's nothing there, but you can physically feel it. It was the golf ball size. Yours was really long.
Yeah, mine did go quite some time. I think for me, it's not assuming that everyone is looking for pain management, because that's not what I was there for. I was looking for any answers. And the teams that I did see during my misdiagnosis process, they all had the assumption that I was there for pain management. Was I in pain every single day? Absolutely. Did I have to push through? Absolutely. But I was just looking for anyone to hear me out.
Did you have a question, Peter?
Yeah, I had a question to Jessica. Did I catch that right, that you got irradiation to your shoulder followed by cryoablation?
Yeah, I had radiation to begin with. That was the first thing they did, was radiation. And then just in the last 2 years is when they did the cryoablations. And
how many sessions of radiation therapy did you have?
Oh my gosh, I honestly don't remember the exact number. It was a couple months worth of a couple times a week. So
you probably have some 50 gray to the brachial plexus.
Mm-hmm. Yep.
And that did hold only 2 years until you needed cryoablation.
That, they said, didn't do anything for me. It did not help at all. So then that's when they started oral therapy after that. And then after the oral therapy failed is when they did the cryoablations.
Follow Aaron's remark. Many thanks for that you are willing to share your history with us. It's not unusual what you tell us. I've seen so many patients with similar careers until they find a doctor, and the major problem is you are all young. Nobody thinks you have something serious. Everybody thinks, oh, do something, it will improve from itself. So I think that's the major part, that nobody would also subject young ladies to CAT scan for irradiation. and the threshold to send you to MRI is even bigger. So that doesn't explain the failures that were made, yeah? But that could show you where the problems in the treatment of such patients are.
Okay, thank you. Yes, Eldad, and then Dale.
Great. Again, thanks guys for coming and being here. And along those lines, from each of you, I'd like to know how did you come across DTRF as a patient advocacy group, and how did that change your experience or the course of your treatment?
Okay, so I actually found it on Facebook, of all places. I had just done a search for it for desmoid tumors, and that came up. So then I kind of looked through everything and then found that's kind of how I found the facility I went to in Milwaukee for the treatment, because it was on their recommendations list. So. Probably a couple weeks after I found it, just kind of trying to see anything on the internet, like any information about it. So.
For me, I found them, again, through Facebook. Once I was diagnosed, I went immediately to social media. As soon as I saw it on my chart, I went straight to social media, and that's how I found it. So it was literally within hours for me. And I met Lynn, which is great. So Lynn definitely has been one of my biggest cheerleaders. She connected me with so many other organizations outside of this one, which I believe that having that community and that support is what people need. When I was diagnosed, I was extremely isolated. My mental health declined tremendously after being diagnosed. So finding the Desmoid Tumor Research Foundation has been amazing.
At the specialist's office, he literally said he thought I had a desmoid tumor, and he was going to consult with 3 other doctors. I was on my phone. Before I left, I was following the group on Facebook. That's where I found them also.
Thank you. And Dale?
Yeah, I guess we heard from Peter, we heard from Kelly about the impact, and, you know, oftentimes there's things in place, so, you know, for support that can apply to people with cancers, but maybe not necessarily with something like a desmoid tumor, because it's not considered a cancer. Have you encountered barriers either through work or even where you're getting treated with not having access to resources because it's not actually a cancer?
So, like I said, I'm a nurse, and trying to go to work and do everything I need to do is very, very hard. And trying to explain it to your boss, hey, I have this going on, and I'm going to be off for treatment or whatever. Their immediate thought is, oh, well, what kind of cancer is it? And then you try to explain it, and they're like, oh, it's just a tumor. Like, what do you need all that for? So it took a lot of doctors to say, write out things saying this is what's going on, this is what you need for to be off work or whatever, or to do. I have to kind of do things a little bit differently sometimes, try to get my job done. So even explaining that to them is it's very hard to. Nobody understands. They're like, oh well, it doesn't matter. It's not an actual cancer. So that's what we get from a lot of facilities, I would think. I don't know what you guys did. Yeah, so thanks.
I would say same. For me, I work in child welfare. So I did work for the first 10 months of being on a targeted chemo drug. And then I did come out of work for 3 months. It was extremely hard for me to even get the approval to come out of work for that reason. But I could no longer bear doing both.
Okay, Christian?
One point that Dale mentioned was barriers you might have faced in your journeys. One more specific question I have is, have there been financial toxicities or financial barriers that have played a role in some of the choices you've had to make? Has that sort of impediment come up? Because financial toxicity certainly plays a role in treatment of a lot of cancers, and we obviously ask a lot in terms of getting scans and labs and drugs and transportation back and forth to specialty centers and things like that. And I was wondering what kind of impact that might have had on your lives.
For me, it's been a huge impact. I have medical debt out of this world, and it's literally only been a year for me. Just trying to combat that with the oncology team that I'm under, and they have been supportive in that.
Does anybody else want to share?
Yeah, sure. Okay. Yeah, I guess taking off of work for like the cryoablations and stuff like that. I was lucky enough to actually have short-term disability on my insurance. Had I not had that, I would not have been able to pay my bills pretty much. So, and like she said, lots of medical debt, stuff like that we can't pay. We don't have the funds to do so. But yeah, just taking off of work and having that, I was lucky enough, but not all the time. There was some times where they don't pay for it. So then you're off for several months and don't have anything for income, so.
I'm a little more fortunate. My employer, I've got very good benefits. I just cannot afford to not go to work because I'm salary, and they will let me go. I'm in a right to work state. So if I don't go to work, I will lose my insurance and my benefits. So while I'm not out of pocket yet, I just was diagnosed. So I have a long road ahead of me yet.
Kelly. Thank you all for your bravery. We really appreciate you being here. The question that I have has to do with clinical trial access. As you have been going through your journey, have you been asked if you are interested in a clinical trial or participating in a study? And if so, how have you approached that with your family and your healthcare providers? What kinds of questions do you have about what it means to be a clinical study participant? And do you feel like, a lot of questions, I'm sorry, very inquisitive. How do you go about making that decision?
I'm an information junkie. As soon as I knew this, I'm finding things, and I did find a trial that I'm interested in that I think I will qualify for because due to the location, I've got a lot less options for me, and my doctor is swaying me against that. Doesn't think that her exact words were only 5%, and I said, well, 5% is more than I'm getting right now. I'm still in the angry stage. I saw the slide. I'm very angry. And I use my humor a lot, so you'll hear I'm a little sarcastic, but that's how I'm getting through this. But that was her response when I said I wanted to be in the trial. They did not test my biopsy for the mutation. I am now fighting with her to get that done, and it's been 3 weeks. I need to know the mutation. They need to do these biopsies. When they do the biopsy, we need to know what mutation. If it was a cancer, they would have already known the mutation. I don't know why we are not, so I have to go through another biopsy to get this. But she is fighting me on it currently, so.
I honestly have not been asked about any clinical trials. I've looked into some of them that I thought would apply, that I could qualify for. However, none of them are around me anywhere. So it's hard to find anything that we can do, so.
And same for me. I have looked, but never anything of interest.
Yes.
Hi, thank you guys so much for being up here today and kind of taking all of our questions. I wanted to ask, do you guys have any positive experiences from your journey, or kind of in other words, what is something clinicians can do more to make your experience better?
Okay, bedside manner goes a long way, I have to say. I met one physician that I literally walked out halfway through the conversation because they literally suggested, oh, well, we could cut off your arm as their response. So I walked out of that. Otherwise, the doctors I work with in Milwaukee are fantastic with it. Like, we can joke around a little bit. Like, they're very like, hey, let's try this. If this doesn't work, we can do, they're very interactive. They can, they send messages on their My Chart and stuff like that, like, just to see how everything is going. Like, that's one thing I think they can do better, so.
I don't know if it's something they can do better. The surgeon that's office I refuse to leave until he helped me has called me every week since my diagnosis to check on me. I know it's kind of a little thing, but that meant a lot. And my oncologist, my sarcoma doctor, and I have all their cell phone numbers. They check on me regularly. I think they just felt horrible because it took so long, but that's been very, very powerful for me. Just knowing that they don't just go home once they're done with me and they forget me. I'm kind of on their mind, and that means a lot, because in my little area, I don't think there's anybody else that they've ever seen. I know the oncologist has never dealt with a DT. I know the spine surgeon has not dealt with one. So I traveled for the sarcoma doctor, and I think she's dealt with 3. So I'm not in a real populated area. But them just checking on me meant a lot for me. That was very positive.
I would agree, and also just being able to answer any questions. I don't let my oncologist leave the room until I'm finished every single question that I have. So just having that time with us, with this being so rare, I feel like we need that time. We don't know what's happening from this appointment to the next. So again, I don't let her leave the room until she answers all my questions.
Okay. Do you have any other questions? Yes.
Thank you again for being here and for sharing your story. You talked about the complex and long process to diagnosis. I guess I'm curious, once you got that diagnosis, could you talk a little about what that conversation was like with the physician or your clinical team around what to do next?
I feel like that was the most overwhelming. It was so many things thrown at me. I was like, can I please sleep on some of this? I didn't know what any of it meant. I felt like it was just a bunch of medical terms being thrown at me. So I guess that's something else they could do better as well. Give a patient some time to process exactly what's, being thrown at them. So,
I have not talked to the doctor that diagnosed me. He diagnosed me, I found it in the portal, waited 2 weeks, and asked to be referred. So I found out through the portal, is how I found out. And he has since retired, so I guess I was on the short list.
Okay, we have one more opportunity for one more question. Ronald.
Thank you for for sharing your such personal stories. We're all here to advance the science and the research and come up with new therapies. Can each of you articulate, what does a magic bullet look like for you? What would you aspire this therapy or anything to achieve for you? Because I think that would help inform the researchers here, to keep that in mind when we all go back home.
Y'all keep looking at me. I guess I just keep talking. Sorry. Magic bullet for me. I need to be able to wake up without pain every day. And I need just part of my life back. There's got to be more than this. And now I'm just fighting with my liver, so it just seems like every time I get somewhere, now I'm back to square one and I'm starting over again. I don't know if that helps you, but I just need part of my life back. And yes, I'm up and I'm moving around. I'm exhausted. Walking from the hotel here today, I have to carry my arm sometimes. It hurts so bad. And I'm trying not to take these pain meds because, I need my liver to cooperate. So I just feel like I'm just running in a circle on a hamster wheel. For me, I know you guys are probably a little different. You've been doing this a lot longer. Still, like I said, this is still so new for me.
I guess mine is, like I said, mobility. I do physical therapy, stuff like that, trying to get my arm to move properly. I've had to literally buy clothes that are a lot bigger than I need to so I can get my arm out of the shirts and stuff like that. I can't wear regular scrubs right now to work, stuff like that. I guess just mine is just finding something that will work to help make it so that we can go about our lives and do what we need to every day without having to struggle.
I would say definitely mobility as well. And then a piece around mental health. I think since being diagnosed, that's the avenue I've taken because I'm telling you, my mental health had completely declined after this. So if we can get something in there regarding mental health, and I talk to my oncologist all the time. There are several people who have walked this road before me, but I want every person that walks it after me to have some type of mental support.
Okay, let's give these ladies a round of applause.